As the COVID cases refuse to fall, we feel that there is an immediate need to understand regarding the second wave of corona and what do we need to do and know about. On these thoughts, today's session would be on the specified subject. We have Mr. Dr. Vivekanshu Verma, who's the Associate Consultant, Medanta Hospital, and he's also the Honorary Toxicology Expert with CBI. And we welcome you, sir. We also have Mr. Atul Kishore joining us and interacting with doctor on various queries related to the second wave of COVID. Atul is the Chief Revenue Officer at an organization called Seva At Home Private Limited. He is responsible for spearheading the corporate relations and establishing value-based care programs. So we welcome you both to Futurist Insurance Broking live webinar session. So over to you, Atul.
Thank you, Shri Priya.
Good morning, Mr. Atul and Dr. Vivek. This is Meher. Thank you very much. Atul, I think you've been working with Dr. Nandita and trying to help us in a lot of our programs. Thank you so much. We look forward to working with your organization and we look forward to this session. And over to you to moderate this session, Mr. Atul.
Thank you, Mihir. Thank you, Shri Priya, for that introduction. A very good morning to all the participants. We are very actually happy to be with you this morning. Thanks to the management of Futurist. And thank you, Doctor, for sparing your time out. These are very, very tough times. To get a doctor to actually come to our webinar during this time is very difficult. Even Dr. Verma is, flooded with a lot of work. And my heart goes out to the entire medical fraternity, as well as all the healthcare workers in the country who are risking their lives to actually look after patients in need. So, as somebody said, and I got this small message on WhatsApp that, look, why are all the temples closed today? This is because all the gods are there in the hospitals wearing white lab coats. So with those words, I just want to tell you a little bit about Seva at Home. Seva at Home is an organization which is based out of US. The whole journey of Seva at Home started with one of the four founders of the organization, three of whom are non-resident Indians and one American. This gentleman went through a personal tragedy in the year 2016. He was working as a director for Alex Partners, and he was based out of Boston in the US. And he would travel from Boston to Hong Kong and then to India to look after his ailing father, who was undergoing treatment for cancer. And sometimes he was there and sometimes he could not be there. So when his father passed away in 2018, it is then that he quit his job and he set up Seva at Home. He realized that there is a need for remote care in our country. There are so many elderly people staying away from their children, needing care. And now with this COVID situation, we have a whole lot of families who have people who are suffering from this dreadful disease at home. So there is Dr. Vivekanshu Verma today to talk to you about this second wave of corona and what do we need to know there. Dr. Verma is an associate consultant at the emergency and trauma care at Medanta Hospital. He did his MBS from JLN Medical College in Ajmer. He went on to do a diploma in forensic science from SMS Medical College in Jaipur. And it will please you to know that he's the youngest Indian doctor to get fellowship in toxicology from the Indian Society of Toxicology. He introduced the Indian Society of Toxicology life support course. And he's also, as Sri Priya mentioned, an honorary toxicology expert with the CBI. So welcome, Dr. Verma, and over to you. You can put your questions in the Q&A box. Dr. Verma will make a presentation and then we will talk to him about your concerns.
Thank you, Mr. Atul, for the nice introduction. So coming to today's topic, I will try to introduce about what is the second wave of corona, what we should know about it. So when we come to the details of COVID illness, we have few doubts. That is, what is the fact or what is a myth. So according to the WHO, there are tips for navigating the epidemic, because now it is a pandemic and the information is flowing globally from all over the world. And we had to verify first what information is fake and what is authentic, because that can create a panic. That's why I've compiled the information in evidence-based manner based on the WHO guidelines on understanding it, just showing what is how the information can affect, how it becomes a misinformation, and it can lead to hurting others, or it can be just the fake information about the government control of lockdown or about the microchips, and misinformation about someone is spreading about it, that it is bioterrorism, and this information is dangerous. This all can create more panic in the society. So we have to follow a chain on how to utilize the information available for betterment of ourselves and our family. The person who starts the information sharing should be a person who is dealing with it practically, and he should share it with the concerned persons who are interested to know about it. These are the WHO guidelines. Coming to the myths and facts related to COVID, that is, it is not a pandemic, that is a myth. WHO defines a pandemic as an epidemic occurring worldwide or over a wide area, crossing international boundaries and affecting a large number of people. So how do we identify that it is a situation in which a mass casualty is occurring? When we have resources, it is the number of hospitals, the number of caretakers, and the people who are suffering, they become outnumbered to the designated place and designated persons, then it becomes a pandemic to handle. And then we have to go for triaging of persons, that the people who are more sick, they need to be attended prior. And there are three factors to help you make a safe journey towards our location, that is to maintain a social distancing, avoid the proximity with the patients who are suffering from COVID, and the time, that is the duration you stay, that should be minimal, so that you get the least coronavirus load. Then coming to another myth, that is the tuberculosis kills more than the COVID. But as per the recent studies, tuberculosis is curable and has medicines, while coronavirus does not have a cure or a vaccine yet. Another myth which is going on is older people were at greater risk during the first wave. Younger people and children are now at a high risk on the second wave. But there is no evidence of the young at a greater risk in the second wave. About 70% of the hospitalized cases are above 40 years of age. The average of patients in first wave was 50 years, and in this wave is 49 years. Why the difference we are facing now? It is due to the number of tests we are able to do now. As the facility of testing is available now globally, so we are now able to identify the cases more. That's why, and the major population is of the youth, and they're getting tested. And when they report it positive, so then we come to know that they have been reported. Then we watch for their symptoms, whether they are developing any symptoms related to the COVID illness. Then we diagnose them as a COVID illness. Otherwise, they are just isolated in home as COVID positive, and they need to be monitored for the oxygen saturation as well as the vital parameters. So that is a fact. Second wave is also affecting people who are already suffering from any disease, like the people who are suffering from kidney disease, from diabetes, from liver disease, from heart disease. They are facing the major mortality. Now the second wave, when we see the number of cases, they are rising daily. So it is not in India, even in outside, we are seeing that it is a sudden peak rise in April. And that started as a second wave in the peak. Otherwise, in March, it was not so number of cases were reported. Now, when we see the snapshot, which is reported recently on 7th May by the government of India, the case positivity all over India, we can see that there are states like Goa, Haryana, Puducherry, West Bengal, they are having more number of cases getting reported, either due to more movement of the people there. Like in Goa, it is a place of tourism, so many people have gone to for tourism, or it may be related to any movement related to the elections, or it may be due to the movement due to job opportunities, searching for the job opportunities. So they all has led to further spread all over country, more or less in all the states. It is not any state is safe. Every state is reporting the cases, but there are more cases in the Goa and Haryana in our place, and then in West Bengal, Karnataka, Delhi, Rajasthan, Chhattisgarh, Madhya Pradesh. So by that we can understand that there's more than 15% positivity in 24 states of India. So it is matter to worry. Second wave, and these are the districts. Even in the district, we see that the metro cities, they are getting more affected because of the congestion of population, people living closely together, hygiene is not maintained, proper precautions are not taken. So it leads to further spread of the disease because it is an airborne illness. So COVID-19, how it spreads? COVID-19 is an infectious disease caused by the recently discovered coronavirus, and COVID-19 virus spreads primarily through the droplets of saliva or discharge from the when an infected person coughs or sneezes. The virus enters the body via nose, mouth, and the eyes. That's why we need to wear a mask and use goggles to protect ourselves, or wear a face shield while interacting with others. Now, transmission of SARS-CoV variant. Now, this has come up recently that the variant is spreading in pre-symptomatic, asymptomatic, and symptomatic individuals harboring the virus. And they are also through the respiratory droplets and even through fecal oral transmission, as per the recent study. So, what is the importance of the variant? The myths related to the new strains have made virus more deadly, but the fact is there is no difference in the mortality rate in the first wave and the second wave. Proportion of fatality is similar in both the waves. So we have to understand that even if we say that it is a second wave, the number of cases we are detecting more is due to the more accessibility to the testing, which is now readily available all over India compared to the last year. And then India has entered the stage 2, not the stage 3. That is a fact we have to understand. It is still misleading and creating a lot of panic among people who are living in the peripheries, and they think that it is spreading and that can cause further mortality. We have to always understand that it is still stage 2. Now, why it is a variant of interest? Now, variants of interest are defined as variants with specific genetic markers that have been associated with changes that may cause enhanced transmissibility or virulence, reduction in the neutralization by antibodies obtained through natural infection or vaccination, the ability to evade detection, or a decrease in the effectiveness of therapeutics and or vaccination. So variation can be beneficial or it can be harmful. So now this SARS-CoV variant is causing more harm to us because it is not getting treated by the therapeutics we were using the last year, and it is not able to be detected in the routine testing, and the neutralization by the antibodies which was attempted, that is becoming difficult with this. So it is more virulent strain which is prevalent, and WHO has identified many strains and they have numbered them, they have labeled them B.1.427 like this. That is to identify that which strain is prevalent. And this is an Indian study in which they have also reported similarly the variants of interest that is rising in peak in March. Now, the most famous variant of concern was from the UK, and it became 43 to 82% transmissible, surpassing the pre-existing variants. And then it was reported in December 2020 in US, causing increased severity of the disease. And that was also reported in the journal recently in April 2021. Now, the harmful impact, as discussed, it is the enhanced transmissibility or virulence, reduction in the neutralization by antibodies obtained through natural infection or vaccination, the ability to evade the detection, or a decrease in therapeutics or vaccination effectiveness. That is becoming a challenge for us in managing the cases. Now, when we see how the variation occurs, so it is a virus is evolution and it causing human devolution. Like other RNA viruses, SARS virus is also adapting to their human host and is prone to genetic evolution with the development of the mutation. So there is genetic shift and drift that occurs, and it is occurring more rapidly compared to other viruses, which was previously like when we saw the swine flu virus. So it is more rapidly changing its pattern, the genetic pattern. So that variation has caused the human devolution. That is, humans were traveling globally. Now they have to stay locally in their own place, isolate themselves. It is the human devolution is occurring due to the virus evolution. Now the virulence and infectivity by COVID carriers, it is general estimates suggest that 2% of the population are healthy carriers of coronaviruses, and these viruses are responsible for 5 to 10% of acute respiratory. You have to understand that many people who are carrying, they are the carriers of coronaviruses. They can be asymptomatic carriers, or they are people who are post-COVID patients, or people who get infected but they do not develop the symptoms, and they are transmitting in the community. So that's why universal precautions has to be followed in preventing the further communication of disease. And another myth which is going is public water supply contaminated with SARS-CoV, then the entire community will be affected. There has been reported there is no significant evidence that shows, but public use like in swimming pools, we should avoid going to swimming pools to prevent the further transmission because it is a droplet infection. It can transmit from one person to another. That needs to be avoided because when we go to the swimming pool, the effectiveness of the mask will not be there because it will get wet, and the water will also seep into our airway during swimming, so that will further cause the virulence of the virus. Then there is another myth which is alcohol-based hand sanitizers increases the alcohol levels in the blood. So there is no evidence has been to support this claim until unless you ingest it or inhale it. There will be no further rise of the alcohol level in the blood because it evaporates immediately on contact. It is isopropyl alcohol. Sanitizers are completely safe to use for maintaining the hand hygiene. Then fomite transmission. There is a dilemma going on whether it transmits fomite or not. That is the doorknobs, computer mouse, trash cans, or sickbed handrails. So there has been studies which has been conducted. One in China in 2020, in which they found that it is transmitted, but it is considered low. The risk is generally considered to be low with coronavirus. Then coming to another myth, that is the virus survives a few hours. Studies suggest that coronaviruses may persist on surface for a few hours for several days. This may vary under different conditions, the type of surface, temperature, or humidity. That is my transmission. And about the pets, that I can catch COVID-19 from my pet. So there has been one instance of a dog being infected in Hong Kong to date. There is no evidence that a dog, cat, or any other pet can transmit COVID-19. So still we have to take precautions because recently there was in Century, it was reported to the lions. They got the infection. So everyone has to maintain the social distancing. We have to maintain the social distancing with our pets also. with our kids also. It can transmit anyone, anywhere. And another myth, is it not safe to donate or receive blood during COVID? So the fact is that the respiratory virus are generally not to be transmitted by blood donation or transfusion. Individuals are not at risk of contracting COVID infection. So it is completely safe to donate blood, especially when we ask for plasma therapy and plasma donation to be by the people who has recovered from COVID. They are requested to donate the plasma for helping others who are suffering the severe illness, severe stage of COVID illness. And another myth, COVID-19 is a simple flu like common. No, it is not like common because that is caused by the influenza viruses, while COVID-19 is caused by SARS version 2. Though the symptoms of both can appear to be similar, coronavirus is more lethal than the seasonal. That is a dilemma because when the season changes, seasonal flu occurs. When the climate from cold to hot comes, like in February, March, that gives a peak of seasonal flu. And many times we miss the people who may get corona infection during this phase. That's why we have to wait and watch for the symptoms and immediately report to the nearby hospital. And if there is a shortness of breath, pollen saturation, we should get ourselves tested for coronavirus as well as get the medications as advised by the specialist. Then there is a myth, if you can hold your breath for 10 seconds without discomfort, you don't have COVID-19. So the fact is, holding your breath for more than 10 seconds without discomfort does not mean whether you are. The better test is you walk for 10 minutes and then check for your saturation level. If you are becoming dyspneic, so your saturation level is falling down in the pulse oximeter, and you are having signs of fever, cough, then you are a corona suspect and you have to immediately report to a nearby hospital and get yourself tested and get a consult with COVID care specialist. Another myth is incubation period is just 5 days. It is a myth. We have seen people developing the symptoms after 14 to 20 days, 1 days. You have to watch for incubation. That's why the word quarantine comes. That is 40 days. 40 days quarantine is somewhat advised in the previous flu, that was 1918. Now we advise for 14 days because this COVID-19 has a range of around 14 days. So we isolate people who come in contact or who have traveled internationally for 14 days to wait and watch any symptoms occur, and they should report to the hospital. Now, what are the signs and symptoms? In the second wave of COVID, we have got very atypical symptoms. Common symptoms, that is the fever, cough, fatigue, anorexia, shortness of breath, they are there, symptom production, myalgia. But people who are suffering from diabetes, people who are suffering from illnesses which are grave illnesses like cancer, we have seen people developing just the symptom of hiccups or giddiness or a syncope that he just fell down or loss of taste and smell. And when we got them tested, they came out to be COVID positive. HRCT was done based on the symptoms, and they were found that they were having fluffy shadows in their CT scan, suggestive of a COVID illness. So they were started on treatment and recovered by early diagnosis and management. That is, we have to wait and watch for the signs and symptoms. If there is any alert signs, then we have to immediately go for further investigation. And there is one myth is going on that it will not, COVID infection will not infect children below 18 years. It is a myth. We have seen cases like a 3-month-old child who came in our emergency and he was suffering from breathing difficulty, fever, and having seizures. This is a typical presentation. They are developing seizures. And when we investigated further, we found that they are having symptoms of COVID, and we intubated the patient, kept on ventilator support, and the child recovered with the treatment by the COVID care team. This corona illness can occur in any age to any person. This disease is known to occur in all age groups. However, the infection is generally mild in children because they are more healthy compared to elderly people who are suffering from chronic diseases. One question comes, then why the children are not getting vaccinated? So the reality is has been no studies which has been conducted till now. There are ongoing studies on children for the safety of the COVID vaccination. Once that safety, the trial completes, then the vaccination of the children also be started all over the world as per the WHO guidelines. Then the myth regarding the RT-PCR test, it is not detecting mutant COVID-19 strains. So the fact is, RT-PCR test is the gold standard of testing. There is no chance of missing detection of any mutant by the RT-PCR test. So this has been by the ICMR study that RT-PCR test can detect. So it can be the sampling error, that the sample if it is not taken properly, or if the person who reaches for the sampling, if the sample is taken from home. So if the sample is taken and it is not properly stored at the low temperature, it can contaminate or it can get damaged, and then it will report false negative. So we have to always watch for, if we are doing RT-PCR test, it has to be by a standard lab which is having the standard protocol of maintaining the chain of custody of the sample which has been taken, so that it reaches to the lab as soon as possible for further analysis and going for reverse transcriptase polymerase chain reaction as soon as possible. That is the RT-PCR form that needs to be done for its evaluation. Then coming to the differing symptoms, mutating virus, even though substantial progress in clinical research has led to better understanding of SARS-CoV and the management, limiting the continuing spread of this virus has become an issue for increasing concern. And SARS-CoV continues to wreak havoc across the world, with many countries enduring a second or third wave of outbreaks of viral illness, attributed mainly due to the emergence of the mutant variant of the virus. So there can be variants which can cause different symptoms to the common symptoms of viral, and that has led to missing out the cases, and they may deteriorate and then they land in critical state. That is something which is creating the havoc. Now the age and gender based differences and the impact of medical comorbidities. Individuals of all ages are at risk of contracting this infection and severe disease. Our patient is more than 60 years and patient with underlying medical comorbidities like obesity, cardiovascular disease, chronic kidney disease, diabetes, chronic lung disease, smoking, cancer, solid organ hematopoietic stem cell transplant patients have increased risk because they are immunocompromised. They have a high chance of getting severe COVID-19 infection. And the percentage requiring hospitalization was 6 times higher, those with pre-existing medical condition than those without the medical condition. That we need to understand that even in the second wave, people who are suffering from pre-existing, they are developing complicated COVID illness. So then comes the myth buster related to the spread. That is, it is spreads through consumption of chickens, eggs, and meat. That is a myth. It does not spread, and people who are vegetarian even they are getting the infection. There is no conclusive evidence. And it spreads through pets. The transmission of disease has not been seen through pets till now, and only a single case of dog transmission has been there. Dead body of a person infected with coronavirus transmits the infection. Now, when we say the person has died due to corona illness, we have to follow the guidelines for disposition of the dead. That is, cremation has to be done in electric crematorium. But since the person is dead, so he's not coughing, so he is not transmitting any generating the aerosol or the droplet. But we have to follow the guidelines of the COVID protocol in disposition of the dead in while handling the dead body of our relatives while taking care in the hospital or when they are is develop the critical illness. We have to wait and watch always wear the proper protection of personal protective equipment while handling them. Now, vaccines are available for treatment of COVID-19 infection. So that is a myth. It is for prevention, not for treatment of COVID-19 infection. Vaccine can prevent the disease, can't treat the because this is that boosts up the immunity against the virus. Vaccine can't cure illness. Then the doubt about RAT, that is rapid antigen test, RT-PCR test, when has to be done. So when, according to the latest guidelines, if rapid antigen test is positive, so RT-PCR test is not required until unless patient develops any symptoms which are related to shortness of breath with pollen saturation, until unless they have to isolate themselves and watch for their symptoms, and home isolation is advised, proper charting of their vital parameters and consulting physician online by television. Connect with CT scan is required only in the second week of COVID illness with moderate disease. And one CT scan is equivalent to 300 to 400 chest X-rays. We need to watch for that. Repeated CT scans are not advisable because they can lead to the risk of cancer because it is a radiation. It can cause further genetic mutations in our and causing carcinogenic activity. Exposing yourself to radiation again and again may cause damage. So even if your family member is getting investigated for CT scan, to maintain a distance from the CT scan room so that you may not get the radiation exposure. So there is no point in doing a CT scan in mild COVID-19 infection if the oxygen saturation is normal. These are the guidelines by the ICMR for the second wave of pandemic, in which they have highlighted the recommended measures to optimize the RT-PCR testing. No testing is required for COVID-19 recovered patient at the time of hospital discharge. And RT-PCR test must not be any tested positive one, either the RAT or RT-PCR is done. And mobile testing laboratories are now available and they can test the people. All asymptomatic individuals undertaking essential travel must follow COVID appropriate behavior. These are all the ICMR guidelines for the RT-PCR testing. Now the myth that center has withdrawn the insurance cover. So it is false. Insurance claims announced under the PM Garib Kalyan package can be settled till 24 to 25 April. Thereafter, a new dispensation will be provided to cover the coronavirus. So it is from the Ministry of Health and Family Welfare. Then another myth is going on that old Chinese doctor has found a cure to coronavirus. It is one bowl of garlic. So there is no scientific evidence to study this, and we should not believe on these myths. We have our hospital is having an Ayurvedic department, and we are having holistic integration for in allied subject. We have studied all these related utilization of all the herbal juices as well as kadas for utilizing for managing cases. So we have found that they just support the nutrition of the patients. They can help to improve your immunity, but they can't cure the illness. In curing the illness, still the role of steroids, oxygen support is there. So a student found that a myth related to the black pepper, ginger, and honey. So the fact is, there is no scientific evidence that they are helpful. Similarly, lemon and turmeric, they will not prevent the COVID-19 infection. No need of ingesting too much of them. You can just take Nimbu Pani or maintaining the proper oral intake because hydration is important. Hydration needs to be maintained, so you can use Nimbu Pani or flavored water which you can add. You can use orange juice or anything, mango juice. The water intake should be there, but it is not that you have to take 4 to 5 lemons for per day because that will not benefit at all. There is no scientific evidence related to lemon or turmeric. So these are myths which are going on about the diets and drinking alcohol. So it will protect. So no, it will not protect. Only rubbing alcohol will help you, not drinking alcohol. So you have to watch for this because it will further damage the liver. Drinking alcohol, and liver makes the immunoglobulins, the antibodies for fighting the disease. And if you are damaging the liver, then your antibodies will not be generated, and the recovery or even the protection from the COVID illness, you will deteriorate further. And that's why consuming alcohol and smoking is totally prohibited for preventing the corona infection. And another, that is COVID positive patients are recovering from intake of rock salt and raw onion. This is also a myth There is no scientific evidence related to this study. Then we had one study which is related to the tocilizumab and cytokine release syndrome related to, that is monoclonal antibody, and it has been found to be effective in severe illness in progression, reducing progression of mechanical ventilation and death in trial. And this has been supported by recent guidelines by the Central Drug Standard Control Organization also. They have also provided the emergency use and authorization of antibody cocktail, that is another monoclonal antibodies which can be helpful in severe illness, but that is to advised by a COVID care specialist while monitoring the patient. They're not for self-administration. And coming to the home isolation, the home care. So what is the precautions we have to follow? That is, if we are suspect COVID-19, we have to watch for the fever, cough, headache, or through these symptoms. And if there are symptomatic family members, there needs to be social distancing to be maintained even in the home. Stay in a single room as much as possible. Separate bathroom utilization for maintaining hygiene, and get, if you develop any symptom, if any of the family members develop any symptoms, get the COVID testing screening done to get an opinion from an expert about the watching for the symptoms. And this, we have to stay home, sanitize hands, isolate and take rest. And all family members should wear masks. Cross ventilation in homes should not be permitted. That is, the windows should the person who is staying with the windows need to be closed among the preventing the cross ventilation from one room to another. But if you are staying in a room and it is closed, you need ventilation. So this ventilation has to be there from outside. If there is open window in the balcony, then you can open it up for ventilation, so that proper oxygenation to be maintained. And body temperature has to be 4-hourly charting has to be done. Oxygen saturation by oximeter needs to be monitored 4-hourly, and seek medical consultation if you develop saturation falls below 93% and breathlessness or dizziness occurs. The treatment for mild COVID disease isolation is drink plenty of water, take soup, coconut water, etc. Lie on chest and breathe deeply on oxygenation. That is, the position is now recommended. Take paracetamol 6-hourly. That is, you can use every 6-hourly after digesting, not empty stomach. And multivitamin and minerals, they are supplements you can take to just maintain your hydration along with the multivitamins. They need not to be overdosed. That is, once a day you can take. And steam inhalation can be taken if you warm water, or gargle thrice a day for relief cough, which is associated with that. These are do's, and don'ts are: do not use remdesivir in care setting, do not use nebulizer budesonide, and do not use oxygen cylinder without that. So this is the ICMR guidelines, and treatment they have also advised on the basis of what treatment has to be followed. That is according to the AIMS protocol. That is to be followed in every hospital wherever patient is getting the universal guidelines which have been issued for the people who are at home isolation, and they get the monitoring advice by teleconsultation for regular health checkup. Home treatment we have discussed, that is practice good hand hygiene, and we have to use pulse oximeter at home to monitor the oxygen saturation. How to use the pulse oximeter? Now in this, the nail should not have any nail polish or hair. That is what to watch for. And when you're checking, you have to see that the waveform that should be clear. It should come up completely up. Then only you can say that it's working properly. Otherwise, it is not applied properly, or the battery is check the battery level while interpreting the results, because it is a handheld device and it can sometimes give an error while reporting. So always cross check in one and another finger, confirming that you are having low saturation level. If there is no breathing difficulty and if saturation showing low, then it can be misinterpretation. So you have to always cross check, wait 20 seconds and check again in lying down position, and keep your hands warm while checking it. Sit still, do not walk, do not vibrate, do not shake your hand while checking it, and you have to keep your uh, hand hygiene properly while checking among your family members. So you have to always clean the pulse oximeter, cross-checking with other family members. Otherwise, it will be might transmit from one patient to another family member by using the same pulse oximeter. So either you separate, or if you are utilizing in the family, then always clean it with hand sanitizer before using it on another person. Now, taking care of managing the cough. Tips to manage dry cough, they are, that is, you have to maintain proper hydration. It has to be maintained in the room. Steam inhalation can be done, and you can use gargle. Gargles can be done. Avoid taking kadha or strepsils because this suppresses cough reflex. Cough reflex is basically to let the sputum out, let the whatever infection is there that needs to the infectious has to come out. Then only the cure will be possible. Do not try to stop coughing. It is better to maintain the hydration, and while you are disposing the productive cough, that is that is to be disposed in the wash basin, the running water, and do not spit in open. That needs to be precaution has to be followed. Otherwise, it will further contaminate. Then, it's smoking. Fatigue management has to be, that is, you have to maintain proper physical exercise, take proper rest. Taking care of your emotional well-being is also important. Do not take stress. Do not panic for your family members or your friends or colleagues. Always act judiciously. Take the proper expert advice from a medical practitioner, and then follow what they advise. How to cope up with the stress? Take a break from the constant watching of the news, or limit the time of the news, and stay connected with your loved ones. Real life your hobbies, take adequate rest, maintain healthy height, and then energy rich foods, that is the healthy food needs to be consumed, that is homemade food which is properly cooked. Outside food needs to be avoided because that will further deteriorate the condition, because it is mostly stale food may be there from outside buying. Ready-made food, it has preservatives there, so better fresh food while ingesting it, or freshly cooked. When to seek the emergency medical advice? Now there are few guidelines, that is worsening shortness of breath, trouble breathing in cough. If you're using a pulse oxygen saturation less than 90%, worsening ability to concentrate or confusion, bluish face, returning fever, persistent fever more than 101 for 3 days, persistent pain or pressure in the chest, inability to wake or stay awake. So these are all the alerts in which you need to report to the nearby hospital and emergency for immediate attention. And don't panic. Don't visit public areas. Don't shake hands or hug. Don't touch your eyes, nose, mouth again and again without washing your hands. Don't discontinue self-quarantine until instructed. So again, there are so many myths going on which are related to like 5G mobile networks spread COVID-19 infection. There's a myth. Then COVID-19 can be transmitted through mosquito bites. It is also a myth. Then there is a threat unless you are older, younger, don't have to be. So they're all myths which are going on to rely on the source of information, then only believe what you read or what you come to know. Maintaining a healthy height, immunity boosters, they are the normal food which you are taking. Better prefer that. If you want to take herbal teas, take a advice from Ayurvedic specialist and follow the advice. Maintain a healthy diet, and home treatment instruction for caregivers. Caregivers are people who are caretakers, like your family members of the people who are suffering from COVID illness. So they become the caregivers. So they have to maintain a proper hygiene. They have to wear a isolation kit suit, that is PPE, while attending close to the patient, while disposing their cough sputum, they do proper gloves. They have to wear masks. They have to wear goggles or specs to protect themselves from getting contaminated, and take a water bath after any close handling with the excreta of the patient. Hand hygiene to be followed. Any exposure to the patient occurs. Avoid direct contact with the body fluids of the patient, particularly respiratory secretion. Disposable gloves while handling the patient. So these are all the precautions you have to carry, because social distancing is required, but caretaking become important, because right now it is a mass pandemic going on, and now we have to in our family we have to take the lead in helping our family, our friends in managing the sickness, the people who are suffering, so we can help them out by following the proper guidelines, which is take proper precautions. Now, utensils and dishes, they can use either disposable utensils and dishes, or you can wash with running water and soap while wearing gloves. And use triple layer metal mask with disposable gloves while cleaning or handling the surface, clothing, or linen used by the patient. So these are the important guidelines which need to be followed. And there's a bit regarding the nebulizer machine. It can be used as an alternative to oxygen cylinder. It is false. Nebulizer machine only helps in bronchoconstriction, that is, having asthmatic symptoms. Then the nebulizer will help in relieving the symptoms, but it will not improve the oxygen level immediately. So if the person is having fallen SpO2 level, is to have a oxygen concentrator or the oxygen cylinder. Now, related to the steam, the myth is inhaling steam from hot water kills virus. So it is first is that virus itself it is not killed by hot water or directly. Inhaling steam doesn't kill the coronavirus. It only maintains your hydration in the airway, and that allows the flushing of the secretions, so that it reduces the irritation from the virus in the airway. How to use oxygen? Oxygen can be used by nasal prongs. That is, if the oxygen saturation is just falling 85%, just the nasal prongs, and 2 liters, 1 to 2 liters oxygen can be given by nasal cannula. Face mask is required if the requirement is 10 liters. Then 5 to 10 liters, then you use face mask. And nebulizer mask is required only when you need to nebulize. Otherwise, just face mask to be applied for maintaining oxygen saturation. The target is 90 to 94%. Breathing exercises are advised. That is the yoga. You can do the light yoga, which is advisable while if you are in mild phase of illness. And there's some few positions to ease breathlessness and moderateness. That is, lie down in left fetal position, or you lean forward sitting position, or forward sitting will help you out in while supporting on your elbows. Or if you are standing, then forward lean standing. That is with support is required, because a high chance of the person to lack of oxygen in the brain fall down. So always stand with the back support. It is immediately necessary to keep standing. Otherwise, try to lie down left head position or prone position if difficulty is there. Now there are guidelines by Ministry of Health and Family Welfare on phoning for self-care. So this is helpful in moderate to severe illness. If the patient is on ventilator, we keep the position, we rotate them so that proper ventilation of the lungs occurs, and that improves oxygen level, but it needs to be along with the glucose. And there should be food intake. If there's food intake, then to avoid going the prone position, because it can cause vomiting by compression of the abdomen and further aspiration of the food. You have to avoid just after eating food. You should not lie down in position. So 30 minutes to 2 hours, you can lie down on your belly in prone position, and oxygen needs to be supported along with the nasal prongs, that to support the breathing. And And you can rotate yourself on the left side 30 minutes to prevent the bed sores which can occur due to continuous lying down in one position. So these are different methods of self-proning you can do, or with assisted proning, that is by using a bed sheet. If you're a caregiver, you can put the person, your family member, in prone position if the oxygen level is uh, dropping and the person is having difficulty, then prone position is helpful. Now, coming to the physical activities after coronavirus, resuming your physical activities, you need to do light exercises by stretching your limbs. That will be helpful. And you have to watch for symptoms which can recur. That is cough congestion, fever, headache, lack of concentration, anxiety, insomnia. These are symptoms which is post-viral illness. It can occur. You have to maintain your self-confidence as a patient, or if you're maintain the self-confidence of the patient, they will recover. Now, remdesivir is not to be given at home. It needs to be on the doctor's advice only in moderate to severe illness. And it is given first week of illness if the person is having to reduce the viral load. So that is by RT-PCR testing, you can see the viral load on that side. It is advised. Giving back the plasma donor, we discussed plasma, that can be helpful to others who have recovered from the corona illness. You can become a donor or convalescent plasma, and that can help. Then heavy intake of vitamin C can help in curing corona. It will not help. It is just maintaining the proper level of multivitamins that is required either by eating fresh foods or you can take supplements. Antibiotics are not helpful in preventing and treating the coronaviruses. So antibiotics are just preventing the bacterial infection which occurs due to when the virus infects, causes loss, lack of immunological response, or there is hypersensitivity illness which occurs, and that leads to further bacterial infection. Or if we are giving steroids for a long time, then it reduces the immunity of the person and they develop secondary infection. Then we have to give the antibiotics to protect them from getting tooth infection. Otherwise, no role of antibiotics in treating the coronavirus. Then the role of, again, the WHO study, role of micronutrients, vitamin B and C, zinc. So there is no role in curing the. It is just to, as an immunity booster, you have vitamin C, but no role in curing the illness. Oxygen conservation studies, there are different guidelines which are available, how you can utilize judiciously the oxygen cylinders at your home by using nasal prong, by sharing the cylinder. If you have 2 or 3 patients in the family, then you can use single oxygen cylinder for providing the oxygen support to your family members. And corticosteroids, the role of corticosteroids, they are only indicated in severe and critically ill COVID-19 patients, not to be routinely taken by suffering from mild illness. Now there are few doubts which are raised that how do I do symptoms persist when it is for end isolation. It is the guidelines are that 17 days before ending your isolation without having any symptoms. When can I resume my office duty? At least 17 days is advised. I was not tested again after the first COVID test. It is not required according to the latest guidelines. If you are symptom free and you have crossed 14 to 17 days, so retesting is advised. Can I get infected with COVID-19? So there are few cases which have been reported in which people have developed reinfection with COVID-19 of different mutant strain which may occur. So in immunocompromised people, they are developing the reinfection more commonly. Can people without symptom transmit the virus? Yes, people unsymptomatic carrier, they can transmit. Can I get COVID infection without ever being close contact of COVID? Yes, there are cases which are reported even if the person is alone all alone in a bio bubble, like recently we saw in the IPL. So they were staying all alone without any contact with the external sports. Even then, they so there's an airborne illness. It is by droplet infection. So we never know how it can come from one place to another, even by any carrier which can be asymptomatic carrier. They can transmit the disease. Always watch for symptoms. How can we use air conditioning safely at home? So temperature of 24 degrees should be maintained while operating the season and maintain the relative humidity. When you're using air conditioning continuously, it can reduce humidity and that can further increase coughing. Preventive steps, that is using the disinfectants, then avoid traveling as much as possible, and you have to maintain the behavior. Double masking is advised for using if you are just using surgical mask, mask, or if you are using N95, one mask is sufficient. You have to, if you're using disposable mask, then you do not carry for more than 24 hours. And if you are using a cloth mask, then you maybe wash that so that it gets properly before using it. Because if carried for consecutive days, then it will develop the infection from that mask contamination. Then the high temperature will not destroy the virus. That is a myth. Sunlight will also not kill the coronavirus. So no role of exposing too much to the sunlight. Now, how the COVID-19 transmission is reduced by staying at home, washing your hands, wearing a mask all the times when you're at home, social distancing, avoid close contact with central air conditioning like offices, malls, etc. Inadequate fresh air, ensure proper nutrition, and seek medical advice whenever needed. So, if you are exercising, is wearing mask necessary? If you are exercising alone at your home, then wearing mask is not necessary. Because further sweating will and it will not be effective because it will become wet. So, if you are doing exercise, do exercise alone, and then you can avoid wearing face masks and do exercise in closed spaces. Do not go in open gardens for exercises. Like, so these are all the myths related to the vaccination. There are myths, many myths which are going on, whether it is it alters the DNA, safe because of quick rollout. There are many myths which are going on, but what we need to focus is that vaccination is completely safe. You should go for vaccination as soon as possible, and vaccination are required for developing proper immunity, but it takes at least 4 months for proper immunity to be developed. So vaccine does not work against UK strain. It's a myth. It is effective for all the strains. And another myth, you don't need vaccination after recovering from COVID. So it is a myth. Even if a person has recovered from COVID, so he can go for vaccination after 45 days and get the immunity booster as the vaccine because it will prevent further infection of the patient. Then there is no need to follow COVID protocols after getting vaccinated. It is a myth. Even if you are vaccinated, you are not completely protected. You have to maintain social distancing and sanitize your hands. That is a fact according to the Ministry of Health. Then there is a myth, anyone with immediate or delayed allergic reaction to vaccine or injection therapies can be vaccinated. If you are having a past history of vaccination related allergy, you have to report it to your hospital or to the practitioner who will investigate and advise you for vaccination. It is safe. Otherwise, if you are allergic to that, then it's not safe to get vaccinated. If you are allergic to the contents of the vaccine, like if it's egg-based, then you may get. If you are allergic to egg, then you have to always report before getting vaccinated. So do not wait. Go vaccinated. Even a single dose of COVID-19 vaccine lowers the infection rate by 65%. Odds of SARS-19 infection were reduced 65% in 21 days since first vaccination, second dose versus unvaccinated without evidence of prior infection. A combination of two studies done by the University of Oxford and National Statistics Office, which which is still to be published, but they have those reduces. What we have seen in our studies that people who are vaccinated, they're developing less severe disease compared to people who are not vaccinated. Then busting the myth related to the periods, that is during menstruation, should you get vaccinated or not? So it is completely safe. Even if there is periods ongoing, you can get yourself vaccinated. Should women avoid workout, exercise, and yoga after getting the vaccination? It is not completely stopped. You need to take rest because sometimes pain and swelling occurs at the site of injection. So take rest. Are there any side effects of COVID-19 vaccine? There are no reported adverse side effects, which are serious side effects, but mild symptoms can occur, which is fever, pain at the site of injection. And anaphylactic reaction can be dangerous. You have to always get yourself vaccinated in a hospital setting so that if any allergic reaction occurs, you can get the proper attention at that time. So then another myth regarding to the vaccine, the second dose of vaccine, whether it is later, has to be taken or earlier. So when we discuss about the Covishield, it should be taken within 6 to 8 weeks, and for Covaxin between 4 to 6 weeks. The later, the better. But the booster dose, still now there is a knowledge gap regarding the booster dose. Are still waiting for the studies to be carried forward. The booster will be required later. Then there are few myths which are ongoing that postpone travel for 2 years. These are all fake. ICMR has reported that this is not the which is issued by ICMR. It is mandated to all to take the vaccination. No, it is a voluntary. Everyone, it is not forceful. It is voluntary that you can take the vaccination. So this is the road ahead coming. There are still the hurdles are there, so there can still peaks which can occur. So you have to watch for even the next year. We can see the peaks. So we have to watch for. We have prepared a year planner for managing medical emergencies. You can see that it is in February. Most of the viral illnesses peak up, and they can occur every year. They are occurring every, and they are different illnesses. They are not just the viral flu, COVID, the swine flu, chickenpox, mumps, rubella. All infections occur every March, and they can transmit during this phase. So closing this our session with a poem during the corona time, that is remain up to date, not just wait. Go get vaccinated on an earliest date. Physically self-isolate. Wear an N95 mask obligate. Hand hygiene has to be adequate. Inhale oxygen and ventilate in nearest hospital until it gets too late. Hope you are able to understand this. If you have any questions, you can
That's a lovely poem to end the presentation with, Dr. Vivekanshu. Um, the audio has not been too great because your voice has been tracking, but I think your slides have been wonderful, and I'm sure people would have read a lot of information from there. But there are questions in the chat box, and quite a few of them, and we're actually already at 12. So I'm not too sure, but no, okay. But let me squeeze in a few questions anyway. One of them says that, Doctor, you had mentioned that it also spreads through eyes. So is it important that one wears spectacles as well apart from the mask? Why aren't the authorities enforcing wearing of spectacles if that is so?
So it is not the if you are wearing spectacles, that is if a person is having a low vision, then they are wearing the spectacles. But if you're not having a low vision, then you can use the face shield. Face shield is a protective device. It will not only protect your eyes, but also protect your nose as well as your mouth. Along with that, N95 mask is advised. That is followed even if you are traveling anywhere. So face shield is advisable while you are handling the patients or you are coming near to the patient or you are visiting the hospital where there is a high viral load. So you have to use the face shield. Even when we are doing any procedures in our hospital while managing the cases, then we use the face shield. Even if I am wearing a spectacle, I use a face shield to protect myself after wearing the PPE. So wearing a PPE, then wearing a mask, which is N95. So it is an extra protection which gives us against because it is a droplet infection, and it can transmit through the secretions, not only from the nose, also from the eyes. That's why we prevent contamination.
Yes, you had mentioned that these droplets are actually hanging in the air. And even if the person, COVID infected patient is not around, you could still get infected if the COVID patient, uh, positive patient has gone by and left the droplets in the air. So please share your views on how effective is the vaccination against the new variants.
So as we have already discussed, that vaccine is completely safe and it is effective against all the variants. Because right now what they have prepared is based on the pattern of viruses which was ongoing. So they right now it is effective, and vaccination is protecting many healthcare workers in our setup as well as in all the setup where got the vaccination done. But variants will keep coming. Even the next year variants will keep coming, but major load is of the virus which is propagating all over the world, and for that vaccine, which is the Covishield or the Covaxin, are equally effective. Both are protective against most of the strains, and as per the studies which is done by the ICMR as well as by CDC in US.
Yeah, so that's good news. But all right, you talked a lot about myths, doctor, and actually you corrected a lot of these myths. There's one that says here that our immunity decreases after vaccination and increases twice after 2 weeks of vaccination. Is that correct?
So vaccination does not decreases the immunity, or it does not immediately increases the immunity. It is just vaccine is having the attenuated virus antigen. They are inserted in the body of the person, and that stimulates the antibody production by the white blood cell, which are the fighter cells. They will prepare the antibody for that, and that will give the immunity in coming months. It is not immediate immunity which will come. So vaccine does not decreases the immunity, but since it is a live attenuated virus, we have to watch for having immunocompromised patient. If they are on steroids, then you watch for the symptoms that they do not develop any adverse effect from the vaccination. So that screening needs to be done. But even if we have seen that people are immunocompromised, people getting vaccinated, they are getting milder infection compared to the people who are not vaccinated.
Okay. Amir has a very emotional question. My mother passed away due to COVID 12 days ago. And we're very sorry to hear that, Samir. It's only me and my younger brother at home and nobody else. And we are totally healthy and there are no symptoms. But there are conflicting opinions. Some doctor says you must get the COVID test done. Others say that there's no need at all. And obviously, Samir is scared to go to a diagnostic center because there are a lot of people there and some of them could be COVID positive. COVID positive. So what do you have to say, recommend, doctor?
So if you are getting exposed, like when we say we can give our own example, we are daily getting exposed to patients of COVID. So we are not getting daily tested for COVID until unless we are having any sign and symptoms related to the illness. That is a fever which is persisting, there is shortness of breath, there is cough is there. If you develop any sign and symptoms, then you have to nearby hospital, or you can take a consultation with your nearby doctor, and you can get an opinion on what need to be investigated, because fever is not always COVID. Fever can be due to many illnesses. Recently, the rains are occurring, so malaria, dengue, these cases are also coming up. So we have to always watch for whether the person is developing signs. Then only we investigate for them. And if the person has been exposed, then they are at high risk compared to the people who are not exposed to a patient. So that watch has to be done. That's why we say that you have to keep a watch on yourself. Maintain isolation, because 14 days it can be asymptomatic. So you have to always wait and watch, follow the precautions, maintain the isolation guidelines, and keep your hand hygiene, that is to be followed, and mask needs to be more. That is the N95 mask. Even if you have attended a person and now you are not attending, even then after that you have to maintain, because the person in contact with that, they can be asymptomatic carrier and you can get infection from them. So even if you are away, you have come in contact, watch for 14 days. That is advised for your
Right. Doctor, is the vaccine safe in pregnancy?
vaccination is safe in pregnancy. There is no harm in that. But right now there are no studies which has been done. That is a issue even with the children. That is, there are no studies which has been done because it is a pandemic going on, and we can't experiment on people like children or people who are pregnant to see the safety of the vaccine. So right now there are no concrete studies which has been done. So pregnancy right now, vaccination of COVID advised, proper isolation and wearing mask, hand hygiene, they need to be followed. If any symptoms of fever, shortness, where they develop, then they need to be investigated for that. And if there are any concrete studies will come, then even the pregnant will get vaccinated, the children will get vaccinated.
All right. So there are a lot of doctors in the group here, and one of them asked a question. One of my patients became a primary contact, had fever. Now has lost sense of smell and taste and has cold symptoms. But RT-PCR is negative. What could be the conclusion? Obviously, a fake RT-PCR negative, is it?
No, it is not about if there is just a loss of sense of smell. So it is not a sign of moderate disease. It is just a sign of mild illness, or even if the loss of taste or smell can be due to stress, due to anxiety. You may lose the sense of smell because your concentration on the normal, what we say, normal, our psychology, that changes when we come to know that we have got exposed to a person. That anxiety creates loss of appetite. People forget to eat, forget to sleep, they develop insomnia. So we can't say that just the loss of smell coming in contact with a person is a sign of COVID illness. And if you have done the COVID RT-PCR test and it is negative, then you have to just watch for 15 days after the contact of the person. If no symptoms persist, nothing to worry.
Okay, I think it's already we've exceeded time and there are a lot of questions. I suggest, Doctor, that you share your email ID in the chat box, and of course, we can circulate it to the audience post this webinar, and they can write to you and you can answer back when you get time. I know you have a very busy schedule.
Yeah,
But
I can share my email. I've shared it. No issue.
yes,
So that would be a pleasure to answer the queries. And I thank to the organizers. They have taken the initiative for generating the awareness. And it was a mutual learning for all of us by sharing the knowledge. And we say sharing is caring. And the word doctor means to teach, not to treat actually. We are
yes,
teaching the knowledge to share, increase the awareness in preventing the disease so that we can all come out from this fatal phase of right now of the pandemics. We can all come up safely, and that's what we can pray to the Almighty God right
yes.
now.
Very well said. Let me thank, on behalf of Seva At Home, on behalf of the doctor. Thank you, audience, for being here. Thank you, Futurist, for organizing this for your entire community. Thank you so much. I hope it was useful. I know that there are still a lot of doubts in the mind. Please do send in your questions to the doctor who will respond back. Thank you very much for being with us.
Thank you so much, Doctor and Mr. Atul, for such an interactive and informative session today at a very short notice. I'm sure most of the queries that we had within ourselves have been addressed by now. And sincere thanks to Nandita and also for Vaishali for supporting us, for all the support rendered to us. Okay, folks, we have also opened a mail ID called covidcare@futurist.in. Please connect back and mail us to this ID with whatever queries you're having or whatever support you would require so that we can actually help you with that. We can also share these queries to the doctor, and we can get all the updates for you as well. So with that, we are winding up the session for today. And thank you so much for your patient attending. And thank you once again all.
Have a nice day. Be safe. Thank you.
Thank you so much.
Thank you so much.
Thank you, ma'am.
Thank you, Atul. Thank you, Dr. Verma.
Thank you. Thank you, ma'am.